Yes. All right.
And by the way, for those of you on Facebook or YouTube, make sure you type it in the comments. Remember, if you have an aha moment, just type nugget in the chat, okay? Obviously, for those of you on Zoom, I'm able to see you and interact with you a little more. But for everybody, I want you participating. So, Jalen, let's take this next one.
Okay. All right. So what is the best next action?
Okay. 1 step or 2 step?
This is a 2-step.
All right, let's give me a story.
Okay. 24-year-old female ate shrimp and now has diffuse hives, facial swelling, wheezing, and dizziness.
Okay. All right.
To me,
There's safety concerns so far.
No, not so far.
Not yet, but we got to watch out for these shrimp. They may jump up and bite us. We're always looking out for
Correct.
them. Now we're going to figure out, is this patient sick or not sick?
This patient is sick.
This patient's sick. We probably need to do something, okay? Then we got to figure out, is this patient stable or unstable, to figure out, do we do it like right now in rapid transport, or do we have a little more time? All right, blood pressure is?
86/50.
Okay. How would I describe this?
Hypotensive.
Ooh, patient's hypotensive. Now, hypotensive, does that make them stable or unstable?
Unstable.
All right, so now I have sick and unstable so far. That's a different situation than sick and stable. All right, I have a patient who's hypotensive. Tell me about this heart rate.
It's elevated.
Okay, not just elevated. We call that tachycardic. Okay, so we have tachycardic patient who's hypotensive, tachypnic, and kind of on the low end of, that's below normal, but it's bordering hypoxia. She's anxious and states, my throat feels tight. What's making her throat feel tight like that?
The swelling.
Okay, she's got the swelling. Now, what's causing all the swelling? So the result is like this. So the result is hives, facial swelling. We've got wheezing. But what's making all this stuff happen? Give me the patho of anaphylaxis.
Oh, okay. You want the beginning, like the sensitization?
Sensitization. Let's start there, my man. Since you want to show out.
All right. No, I'm not trying to show. Okay.
Let's go.
All right. So first, when your body gets introduced to the antigen, your body.
Okay. And in this case, we're going to call it an allergen. So your body gets exposed to some kind of allergen. Keep going.
Then your body becomes sensitized to it. So then you have your IgE.
Okay. So your body starts making antibodies to be able to fight this. And the main antibody that it's going to make is the one called immunoglobulin E, IgE. Okay. There are 5 classes of antibodies: IgG, AMED. So game with a D on it. So let me put you on game. But the one for allergens is IgE. Okay. Now, that's what happens the first time. And who makes these antibodies? That's going to come from B cells.
B cell.
Okay. Now, your second exposure, what happens?
The IgE makes a cross-link.
Ooh, check you out, my man. All right. So we got a whole bunch of IgEs that come together. That's called IgE cross-linking. Good. What happens next?
Then we have the mast cell that creates histamine and leukotriene.
Nice. Okay. So I love it. Okay. So we have histamine release. We also have leukotriene release. And what happens is the cell membrane gets damaged of these mast cells. And now when the membrane gets damaged, it's like the border is not secure. So stuff can go in and out. And what happens is this histamine leaks out and starts going over in the skin, and it causes hives, itching, rash, things like that. Also, when this histamine and leukotrienes get out, for instance, in the airway, they're going to cause bronchoconstriction. In the capillaries, they're going to cause increased capillary permeability. That just means the capillaries start leaking out. In the arterioles, that's going to dilate the arterioles and cause vasodilation, and that's what's going to lead to the shock. So this patient has anaphylactic shock that was started off by histamine release due to this. So this cluster, let's go back over that again. You have this cluster of IgEs that came together, and they go over to the mast cell and say, hey, mast cell, you got to break up your party. You got to go home. The histamine and the leukotriene, they get upset, and then they start wreaking havoc everywhere. We get histamines and leukotrienes causing local reactions in the skin and causing more severe anaphylactic type reactions systemically. Okay. This is why we're going to use different medications. So let's talk about what happens. We have, remember, in the lungs, we're going to have bronchoconstriction. So in the lungs, we have bronchoconstriction. In the capillaries, we're going to have capillary leakage. So stuff is just going to start leaking out of these capillaries. In the arterioles, we're going to have vasodilation. Okay? This is why we're going to use different drugs to handle different things. What is our number one drug that we're going to use in anaphylaxis?
Epinephrine.
Our number one drug is going to be epi. Why? Because epi has three main effects. What are they?
Alpha 1, beta 1, and beta 2.
Okay, alpha 1, beta 2. I like it. This alpha 1 effect of the epi works right here. Alpha 1 causes vasoconstriction, so it's going to counteract all this vasodilation. Okay? The beta 1 effect, one of the side effects is it's going to increase cardiac output and it's going to increase heart rate. This patient's heart rate is already tachycardic. We're probably going to make it more tachycardic, but they'll at least be alive. So this is just a side effect. We don't want it to happen, but it's probably going to happen and we can't do anything about it, but we got to look for it. Okay? We got to be prepared to handle that. The next big effect is this beta 2 effect that causes bronchodilation. Because remember, we have all this bronchoconstriction. We're going to counteract it right here with this beta 2 effect. So because the epi is going to work right here, the epi is going to work right here, it's going to help with two big problems. That's why it's the first line drug, even over oxygen. It handles more problems, okay? So find me an answer for the first line drug that we're going to give for this patient.
C.
C, okay? Now, why is D not the right answer?
Because albuterol wouldn't be the first treatment.
Yeah, albuterol is going to work here, but it's only going to do one thing. Both the albuterol and the epi, both of them have a beta 2 effect. It's just the epi is going to do more to prevent this shock from getting worse. Okay? The albuterol is not going to help this shock part. Keep going. What were you saying?
I was going to say also, isn't this a perfusion problem?
It is. It's it is.
Primarily.
This is one of those examples where you have a lot of problems. This is actually where you have an oxygenation and a perfusion problem. It's just the perfusion problem is actually in this case, the airway closing is what would kill them first, even over the perfusion, because they at least have some perfusion, at least for now. They may not have much perfusion in 5 minutes. So in this case, what's going to kill them first is their airway closing. That could kill them in the next minute. But epi is still going to help with that, but it's also going to help restore the perfusion. Okay? Why is B wrong?
Because that's like delaying care.
Right. And definitely placing her supine is probably going to make it harder to breathe. She's already struggling. We don't want to make it worse. Okay? And why is A wrong?
That's not the first line of drug that we would give.
Oh. Is diphenhydramine a drug that we will use in the setting of an allergic reaction or anaphylaxis?
Yes.
Absolutely. How does diphenhydramine work? What's its job or what's its class?
It's called an antihistamine.
It's an antihistamine that's going to counteract all this histamine release. It's just a drug that we're going to use later. And then one of the other big things that's going to happen is we're going to end up with all this inflammation. And what's our drug that's going to kind of help counteract some of this inflammation?
Methylprednisolone.
Methylprednisolone, so solumedrol as a corticosteroid. Okay, good. So in this case, epi, first line drug for anaphylaxis. You want to do another one?
Of course.